Dynamic zero COVID no more in China? Over the past week, COVID policies in major cities across China have been changing rapidly by the day. Chinese Vice Premier Sun Chunlan, seen as the central government's COVID czar, has said new epidemic prevention and control measures will be implemented as the country faces a new situation, quote unquote. What compelled this change in policy? How does China plan to optimize the measures, and what may lie ahead in China's road to dovetail its measures with the rest of the world? I was pleased to be joined from New Haven, Connecticut, the United States, by Dr. Sten Vermund, professor at the Yale School of Public Health, from Nanjing in Jiangsu Province in southern China by Professor Zhiwei, director at the Center for Public Health Research at the Medical School of Nanjing University, and by Jeffrey Schlegelmilch, director of the National Center for Disaster Preparedness at Columbia University, joining us from Manchester, Connecticut, the United States. Professor Wu, let me go to you first. As I said, last week, Chinese Vice Premier Sun Chunlan said for the next phase, progress should be made while keeping steadiness, and measures should be optimized continuously with constant baby steps. So does it mean that China has abandoned its dynamic zero COVID policy? And will there be a fine balance between caution and softening of the measures?
No, China has not fully abandoned its zero COVID policy, but at least China is moving toward to justify the restriction and prevention measures. There are three major reasons for this. One is the virus is very different from the virus we had last year and before last year. Right now, the virus is much weakened. It does not really cause severe diseases. The second reason is that we have been going through 3 years of prevention. There is a tremendous impact on the economy as well. And also the third reason is that people are going through whole 3-year restrictions. A lot of people are frustrated that their life is impacted. So I think those are the major driving force while we need to adjust our policies.
Dr. Vermund, how do you look at the changes that are happening in China? Do you think they're in the right direction?
I think it's inevitable that societies have to open up. It's not economically feasible to keep lockdowns and the waves of lockdowns as rigorously as I think China has done. I understand why they've done it. They've tried to keep their citizens safe, but there is a point at which vaccines are a powerful new tool, and they do change the dynamics considerably. The inactivated vaccines do provide considerable protection against hospitalization. They don't give quite the level of antibodies that the mRNA type vaccine does, but they're not bad. And what I think would be really almost optimal is if we could use the Chinese inactivated vaccines for priming and then boosting with the mRNA. That might optimize immunologic status of the Chinese people to minimize the risk of serious disease.
We'll talk about vaccine in just a moment. We'll try to leave some time for that. But Jeff, let me go to you from the perspective of disaster preparedness. I don't know how much in the medical sense you can touch upon, but how do you look at the transition and the challenge that the country is facing while we're adjusting such an important policy in a country with 1.4 billion people and many different layers of preparedness, of awareness, of availability of financial resources, and so on?
Yeah, absolutely. At the end of the day, it's not really a do no harm scenario. It's which approach is going to cause less harm than the other. And as my colleagues have mentioned, now that you have more vaccines and more treatments and things like that, the consequences of getting COVID are not quite as severe as they used to be, although they're still very severe. And so countries around the world, and China in particular, is trying to balance this, right? What is the measured approach to preventing infection and keeping it at a level that is manageable within the healthcare system, that is acceptable within the population, with a dynamic that's changing with new variants, with new countermeasures, and sometimes they work better, sometimes they work less than others. And then to your point, more perhaps even more importantly, is in addition to the medical sciences, the social sciences. You mentioned people approach this from different walks of life, different levels of trust, and so that has to be addressed as well too, to help make sure that people are engaging in the behaviors that we want them to keep them safe.
Yeah. Dr. Vermund, let me go to you because you have the experience of the United States. In the case of the United States, the situation was approached differently, and the number of deaths is still very high. Last time I checked was something like 459 a day in the United States over the past 7 days. Is China potentially looking at a very drastic number of confirmed cases and deaths? Are you concerned?
We do have a big problem in the United States of vaccine hesitancy. And we're only managing about 73% of the population having had even just one vaccine. And the proportion of the population that's received the most recent booster, which includes an Omicron antigen, is well under 10%. So the lack of full coverage of vaccination and the inability of successfully boosting the American population is the central reason why we continue to have several hundred deaths every single day. I believe in China you have analogous challenges, and you will need to expand your vaccine coverage.
Professor Wu, how big is that a challenge for China? Because we have an aging society, the population of people aged over 60 are very big in society. And last time I checked, actually this morning, for those aged over 80, only 40% have gotten a booster shot. I mean, that's better compared to the United States, but still, is that going to be enough to help people ride over this coming potential wave of infections as cities losing to a certain degree their measures?
Well, that definitely is a big challenge because that vaccination rate is still way too low. I think this is something actually we need to do. If we're trying to open up the society, we need to promote the vaccination of this elderly population and people who have basic medical conditions. But overall, the population has 90% fully vaccinated. I think that would give us some confidence that we should be able to reach more people in the elderly population, because in the past, we haven't made sufficient efforts in this particular sector of the population.
Is that work being done? I mean, I understand from what I see, the emphasis is being stressed that elderly people should go ahead and get booster shots, the pace should pick up. How do you look at the efforts right now? Do you think that awareness is there, that extra effort is understandably needed?
I think, right now, if you look at some of the public relationships in terms of in the public media, that we do pick up the speed in promoting this effort. But I think it's in the past there was a mistake that we haven't put enough effort in convince those elderly people to receive vaccines. But I think it's critical that we should mobilize the communities, municipalities, and people to get more people vaccinated.
Yeah. Jeff, again, in terms of disaster preparedness, what is your biggest concern at this moment watching what's happening in China? Because right now there's quite a bit of confusion as policies, adapt and get developed, and the situation changing by the day. A lot of confusion, a lot of complaints, of course, and different levels of understanding and of measures. Some cities are more open, more softer. Other cities are stricter. How do you look? What do you think is the most important thing to keep in mind for the administrators and for the general public?
Yeah, I think in terms of for administrators, in a lot of ways, this is actually a more difficult time for policy decisions than early on in the pandemic because it's such a gray area, right? We have vaccines, but there are new variants coming, and then you have new cases. And so everything is in a state of transition and everything has some degree of uncertainty around it. And I think it's something to acknowledge and something to be very transparent about. When working with communities, when working with individuals, I think one of the most important things really does come down to the behavioral science. The medical science can create countermeasures and evidence bases and vaccines, but at the end of the day, why are people choosing to do what they do? What are their concerns if they're not doing it? I'm concerned with this elderly population that isn't vaccinated. Why is that? Why are they concerned about the vaccine? Is it an access issue? Is it a trust issue? And a lot of times people need to hear it from leaders in their communities that might not be traditional leaders. They might want to hear it from a professor or a doctor, or maybe someone that they see at the community center who they look up to in the community. So there's a lot of multifaceted work that needs to be done on the social side to make sure that these medical innovations are really achieving their full potential.
Dr. Vermund, from the point of view of public health, another concern is the availability of ICU beds. China definitely not on par with other developed countries in terms of preparedness in this regard. And there may be some panic. The public awareness is not there about how to deal with the virus. It is something new, so people still have this fear factor. What do you think is the most important job to do now? And what do you suggest, if you were asked, to the Chinese policymakers to focus on at this moment?
There are ways to keep people out of the ICU, and Professor Wu has highlighted the importance of vaccines, particularly in the vulnerable populations. We also have therapies in 2022 that we did not have in 2020. The immunotherapies like Paxlovid is the trade name in the US, which is a combination of two drugs taken twice a day, can be used to keep people out of the ICU. And if China can source enough of this drug, make it available to persons who have incipient disease, we can substantially blunt the impact of the disease with this new therapeutic approach.
Yeah, but here is a debate. And earlier you mentioned the vaccine as well. And Professor Wu, I'm going to put this to you. There is this school of thoughts that China should import the foreign vaccines because the whole world practically have been tested on them. And these imported drugs. But on the other hand, China also has its own and great variety of vaccines, which are tested in real practice, clinical tested in Hong Kong, for instance, with millions of doses administered. And traditional Chinese medicine in treating COVID, either preventing or treating the early stages, even, medium cases. So what is your understanding of China's practice of trying to use as many domestic resources as possible?
Well, I think there are a number of issues involved here, whether, you're importing a better vaccine or mRNA vaccines, whether you, invest more in the drug development in the country. The issue is that not only the economy, but also in various other issues as well. For example, the vaccination issue, that we had 90% of the population fully vaccinated. Of course, you could import the mRNA vaccine, but the question is whether the combination of the inactive vaccine and the mRNA vaccine as a booster has been tested, whether it's more effective. So you can't simply just buy mRNA vaccine and inoculate people who already received the inactive vaccines. So there are scientific issues involved as well. But I do agree with Dr. Vermund's point that maybe that by doing combination of various vaccines, you could provide better protection as well. So this is something actually I think the decision makers should be seriously considering.
Okay, Dr. Vermund, you want to react to that?
Well, I do think that we have data now, published data on what we call heterologous vaccine delivery, namely you use one type of vaccine for primary series and then you boost with another one. And it turns out to be safe. It turns out to be highly immunogenic. And I personally think, judging from the literature, that would be China's best option.
I'm going to ask one last question because the WHO has just warned that a drop in COVID alertness could create deadly new variant. Professor Wu, what is your understanding from a scientific point of view? Does it mean that what China is doing now could potentially create more, deadly new variant, or have we all been wrong? I mean, the whole world, have we been wrong for loosening up bit by bit, not a drop, but loosening up?
Well, I think that's an oversimplistic assumption, because if you look at the virus historically, when they evolved in human population, they usually getting weakened, and also the COVID-19 is it's no exception. People trying to always compare COVID-19 with flu virus, which is a very different virus. So I think the WHO is right that you can't just simply drop down the warning on the COVID-19. The thing is that we're talking about the opening up. It doesn't mean that we just lie flat without doing anything. Of course, some necessary public health measures will be implemented as well. The point is we're trying to ease the restrictions to make people move around easier and have less impact on the people's life and economic activities.
That was my conversation with Dr. Sten Vermund, Professor Zhiwei, and Jeffrey Schlegelmilch. After the break, President Xi Jinping met with EU Council President Charles Michel last week in Beijing. How will the meeting inform bilateral ties? Stay with us.